What can you do if you and your partner are told that you are AS and AS and your bond is so strong that you cannot do without each other, or you've gotten to the stage of getting married after several years of relationship and this is practically impossible to separate both of you? There is still an option. Come closer. These decisions are made considering certain factors. Number one is financial capability of the two people involved, which in this case, I see that these two fellows here, money is not a problem in their case. So tick for that one, for that factor. They've got the money, they've got the financial capability to be able to do what I'm about to tell them to do. Now know this and know peace. If a lady who has AS marries a man who has AS, smaller percentage, that is 25%, there's a smaller percentage chance for them to produce children who are SS, that's sickle cell children. Just 25% chance. There is also a 25% chance of them having children who are AA. Or you don't know that they can produce children who are AA? Yes, it's possible. So AS plus AS, you're going to cross match the both of them. So the first child can be AA, can pick A from the father and pick the A from the mother, and that's AA. The second child might pick A from the father and pick S from the mother, that's AS. The third child might now go to pick S from the mother and S from the father, that's SS. Do you understand me now? So there is a possibility that they can have an AA child, they can have an AS child, and they can have an SS child. But in a case where we don't even want the SS children being produced by these two partners who are of the same genotype, something can be done. And this is solely dependent on the availability of money, which in their case is not a problem. So come closer, let me tell you what to do. Number one, go for what is called genetic counseling. This is not your regular doctor visit. No. It is not your regular doctor consultation. No. We have people who are specialists in this field. They are called genetic counselors. That is the first step you should take. And not all of these happen on social media. If you're wise enough, I will advise you check for a genetic counselor in whatever area you live in, even if it means traveling to another state to meet this person. Now, the reason for this genetic counseling is to give you an opportunity to speak to a specialist who understands this and will give you advice on what are involved, the benefits of marrying an AS person, the risk involved, and what can be done as a solution. You understand me? Peradventure, you both decide to still get married. You need to make an informed decision, an informed choice. Now, making an informed decision means you're not actually making a choice because of what people are telling you. You're making a choice because you have been adequately informed. You have gathered enough information about your condition before you now decide. Sit down with your partner and now say, okay, the genetic counselor told us this and that. Because of this and that, I think we can still go on and get married. We still have, options available for us, for the children. Or, remember the genetic counselor told us this and that. And I think at this point, because this person is a specialist in this field, I think we should just listen to him or her and stay apart. Do you understand? That is making an informed decision. After carefully listening to somebody who is a specialist in this field, who will give you all the information necessary, you will now have the opportunity to ask your questions. All right? So that's genetic counseling. That's the number one step I want you to take. Number two, there are options available if you don't want to have children who are sickled cell or who have sickle cell as their SS as their genotype. Yes. Number one, you can opt for what is called prenatal testing. Prenatal testing. That is in the early stages of pregnancy, between 3 months to 4 months. Okay? Between this period, 3 to 4 months or 3 to 5 months. This prenatal testing will be done, and a certain procedure called amniocentesis will be performed by a specialist. Now, when an egg is fertilized and a woman gets pregnant, as the pregnancy grows or advances, there is a fluid, as water, let me use the term water to a layman, that will be formed around a sac inside the woman's womb, which the baby will be swimming in. So there will be a sack that's like a bag, and there'll be water inside that bag, which the baby inside the womb will swim in. Now, this water has a lot of benefit. It helps to cushion the baby from some maternal structure so that there'll be no injury internally. It helps also to serve as a medium of exchange for nutrients for the baby, a lot of things. Some of the baby cells are found inside that fluid. Now, my main concern is the tests that will be done. It is known as amniocentesis. Now, the doctor will invite this lady when the pregnancy is about within 3 to 5 months. Can be done at 3 months, can be done at 4 months, can be done at 5 months, but the earlier the better. He will use an ultrasound machine to actually scan the woman's abdomen. All right, when the abdomen is scanned, depending on the stage of the pregnancy, if it's within 3 months, we know it will still be in the pelvic region, that's around the waistline. So the scan will be done to visualize this fluid where the baby swims. Once that fluid is found with using the ultrasound machine, what the doctor then does is to use a needle, a tiny needle, to pierce through the abdomen, the skin of the woman, right deep into where the fluid is found. And a certain amount, a small amount of the fluid will be taken, all right, and sent to the lab for testing. They will test it to see if there is any trace of SS genotype for that baby that is developing. Yes, that can be done. Technology has improved. We're not in the olden days or the era where there was no solution to anything. Today, the world has evolved. So, being an SS genotype, you can still marry whoever you want to marry. Like I said, it's subject to 1, your level of exposure, the information you have gathered from a specialist. 2, your financial capability. If you have the money, then go for it. As if you love the person enough and this person is an understanding person, you both can pull through together. So when this test is done and they determine that there is an SS trait for this child that is developing, then you will now be advised by the specialist what to do at that point. Do you want to continue with the pregnancy? If yes, then they will start preparing you even from that early stage what the medical plan will be for the child when the child is born. With adequate care, we have people with sickle cell who live till old age. Yes, I have seen one. I've seen a lot. With adequate care, you don't even allow them to break down. You just know the cycle, you know the routine, what you do for your child monthly. So if you decide, oh, I don't think I want to have a child with SS, this is an early stage, the pregnancy will be terminated. And then we'll try again. So that is called prenatal testing. That's one option. If you don't want to go with that option, there is yet another option, which is called IVF. In vitro fertilization is popularly known as IVF. Now, in this case, it's not just an ordinary IVF that will be done. It is an IVF with PGD. Now, this is not postgraduate diploma. PGD there means pre-implantation genetic diagnosis. I don't know if you understand what IVF means, like what procedures are involved for an IVF to be done. What an IVF involves is this. A lady comes, her husband comes. Oh, we want to get pregnant. I want my wife to get pregnant, but I don't want her to actually go through the natural way. I don't want to sleep with her to get her pregnant. Can you take my sperm? So the sperm of the man will be taken. This woman, before the sperm is taken, the woman will be placed on some hormone medication, okay, to help her ovaries produce eggs. When the ovaries produce eggs, she'll be monitored to see when the eggs have become fully mature and ripe for fertilization to take place. Okay, that's probably during your ovulation. It's going to induce ovulation, induce production of eggs. Now, the woman will go in for the procedure. The eggs will be taken. They will use a needle, a tiny needle, to select the eggs from the ovaries of this woman. Okay, when the ovaries are selected, the eggs are selected, put in the lamp, in a dish. Okay, the husband's sperm will also be taken and then put on each of these eggs, not just one egg, several eggs. And when the eggs are fertilized in the lab, they become what we call embryo. That's the tiniest form of babies, like the undeveloped form of a child. All right. Once it gets to a point where they've become embryos, some cells from that embryo, okay, will be taken using a needle to pick some cells from the different embryos, the different eggs that have been fertilized. They will pick cells from them and test to see if there is any traits of SS, if there's anyone with AS, if there's anyone that is AA. They will now select the best. So they will discuss with the both partners, oh, we have done tests on all these eggs. I think there is one with AA. There is also another one with AS. You now decide, oh, I want the one with AA, and that's the one that will be taken to now insert into the woman's womb. It is called implantation. They will implant into the woman's womb artificially. And then the baby will grow. They will keep monitoring the pregnancy. The woman will be pregnant, carry her baby by herself. So it's called IVF with PGD. That's in vitro fertilization with pre-implantation genetic diagnosis. And you give birth to your children. You choose the genotype you bring into the world. I don't know if you understand. This one means that you are the one to decide, to choose what genotype you are bringing into the world. IVF is expensive, but if you have the money, like these two, I see and I feel that they've got the money, they can opt for it if they both are lovers and they feel that this bond cannot be separated. So instead of forcing them apart, can we consider what are the choices, what are the options available, and they can now make an informed decision. So for me, I will advise them to go for the IVF with PGD. What is the other option? The other option is adoption. Come on, getting married to someone with AA is not a guarantee that the person is going to have children for you. What about couples with the perfect genotype combination who have stayed for years without having children? What would you do? You're not God. You see a young lady, she's beautiful, you go in to marry her. You're not thinking if she has a womb, so you just feel like once you get married, you have children. What if children doesn't come at the time you expected them to come? You will now opt for IVF. You will opt for several options. So this is not about genotype here now. Adoption is the last resort I will advise. Having children or being a parent does not mean you must naturally produce children or bring children into the world from your womb. You can be a mother to a child that another person carried. Surrogacy is also an option where another lady carries your seed. So the sperm from the man is taken, and then probably another lady outside will be used as the incubator. Let me use that word, as the incubator, because she's the carrier now. She's the one to carry the baby, not his wife. But it is a sperm, so it is their child. I don't know if you get. Technology has improved. It has evolved. If you both have decided to still get married, knowing that you're AS and AS, the bond is there, the love is there, you have peace of mind with this person, go on. But I will advise you to go for genetic counseling first. And number two, these options are available. The genetic counselor will even tell you about the options. IVF with PGD will be your best option here. So it is your wife that will carry the pregnancy. It is your sperm, it is her eggs. But then the best eggs will be selected to be implanted in her womb artificially. Rather than probably separating because of genotype and ending up with someone who you might just be miserable for the rest of your life. You're not happy. What then is the essence of marriage? It was first for companionship, even before procreation. So the essence of getting married, number one, is not because you want to have children. You can actually have children even without getting married. The very essence of marriage, firstly, is for companionship. To have somebody to talk to have somebody to bond with, to have somebody you can actually lean on his or her shoulder at times when you feel like you can't do this alone. Children come as a blessing out of that companionship, if you understand what I mean. But in the society today, we've made it just about the children alone. It's not just about the children.